Hi, my name is Sabrina, and today I'll be arguing that imposing taxation on sugary sweetened beverages promotes public health. Now, what do I mean by sugary sweetened beverages? This may include, but are not limited to, energy drinks like the Red Bull I just had an hour ago for the speech, carbonated beverages, and artificially sweetened beverages like those that do not contain natural flavors. My reasons why I support this argument. 1, consumers are discouraged to consume sugary sweetened beverages because of these higher taxes. 2, imposed taxes support public health and nutrition programs. And 3rd and last, individuals who purchase and therefore consume less of these drinks towards their diet decrease their risk for chronic illnesses. Now, my first secondary claim was that consumers are discouraged to consume sugary drinks because of these higher taxes. I'm pretty sure that if you have a tax on your favorite food, you wouldn't want to buy it because you're spending more. According to a study by Lindy Silver and her colleagues from PLOS Medicine, they had surveyed over 15.5 million checkouts in the city of Berkeley and found that sales of these sugary drinks dropped by 9.6%. It's not just because of the health concern. I believe that consumers, based on the statistic, didn't want to pay extra for the drinks that they usually have, and therefore they are pushed to think more deeply about what the consequences are financially and health-wise. This goes to my second statistic that I will bring up. According to the New England Journal of Medicine, Kelly Brownell, a research professional, and her colleagues saw that support for food taxes rose from 33% in 2001 to 41% in 2003, and then in the next year it went up to 54%. They also did a poll in the state of New York and found that 52% of the respondents of that survey support the tax, and 72% of it would support it if it goes to programs that educate the community about public health and the prevention of obesity and chronic illnesses. This goes to my second secondary claim that imposed taxes support public health and nutrition programs. Part of the taxes will go towards public health services like WIC or SNAP or any of those national programs. According to the New England Journal of Medicine, they would say that $14.9 billion could be made in revenue from this national tax if the rate was 1 cent per ounce. So if a can of soda is, let's say, $1, you're just paying 8 cents extra. So it's not that much. It's a win-win situation for both high and low income background families, according to Alexandra Sifferlin, who is a Times reporter. She claims that if you're from a high background family, not only are you able to afford these sodas, but also that you will know that those taxes will go towards these national programs. And if you're from a low background family, you would know that instead of spending money on unhealthy foods, you are pushed to concentrate much of your spending on healthier options. And because of that, you'll probably think, this has something to do with healthcare. And this goes towards my next example. Dr. Douglas Betcher, director of World Health Organization, he said during a report with Allison Aubrey of NPR, there would be a $65 million amount in healthcare cost savings if we initiate this tax on sodas and sweetened beverages. My third secondary claim is that individuals who purchase and therefore consume less of these sugary drinks will decrease their risk for chronic illnesses. I'm pretty sure that a lot of one thing is bad for your health. Just to give you some background info, WebMD states that if you have an excess intake of sugar, it leads to a condition known as hyperglycemia, and hyperglycemia can affect your nervous system and other vital organs relating to the digestive tract. And in addition, the Center for Disease and Control states that Americans, 50% of the population, on average have 1 can of soda per day. So that does amount a lot. And some adolescents are consuming about 40% of their calories from sugar. So that's about a meal per day of sugar. And I would say that's not really as nutrient dense as if you were to purchase or consume wholesome foods. And as consumers, sometimes we do tend to overlook these products. So by having this taxation, we are more aware of our choices and how it could impact us in the long run, financially and health-wise. Thank you for listening to my argument. I hope that you as an audience and consumers are more aware of the long-term consequences of your health and also be more aware of your health decisions.
All right, the proposition's clearly stated. Good. There's a good preview. The controversy, I think, needs to be talked about a little bit more. The status of actions where cities have tried to do this or states have imposed these kinds of things suggests that maybe there is a movement on this, and I think you give us a little bit more context on it. But I think that people can see what the argument is, why there's a dispute on this. You have a pretty clear preview. You're signposting the secondary points when you get to them. There's usually a good explanation of the concept on each of those points, although there was one section where you did talk about public support for those kinds of things without necessarily demonstrating that the public support is going to change anybody's actions or behaviors, especially what the part of the public that doesn't pay the tax because they don't consume those products. I'm sure they'd be happy to let other people increase their tax burden. I think that's one of the reasons why there's controversy on this situation. So I don't know that proves much for you. That felt to me like the least useful information. The more useful information had to do with the example that you had in Berkeley where there's a decline in the number of sales. You had some testimony evidence from authorities and experts who believe that it's going to result in increased revenues, although the idea is that I suppose that if we're going to decrease consumption, those revenues will probably decrease to some degree as well. So it is kind of a contradictory policy to some degree, because ultimately your goal is to reduce people's consumption, but if you do that, you won't get the economic benefit. There's a presupposition that the economic benefits would automatically go to a particular category or classification of service. That, of course, would depend entirely on who's imposing the tax and where they designate the money is going to go. That gets into a policy discussion, so I think that's almost out of bounds for this kind of argument. And the notion that any of those kinds of programs would be effective at educating people or diverting them from bad lifestyles or that sort of thing, there's no information on that, so I think that that's a little bit problematic. I thought you did an excellent job citing your sources. I heard a source citation for all of your statistical information for several of the pieces of testimony and a couple of examples, so I thought you did a good job there as well. All right, thank you.